Music festivals. Loud, bass-heavy music, close friends, fun times, and for a lot of young Australians, MDMA. According to the UN World Drug Report from 2014, Australia had the highest rate of ecstasy consumption on Earth. A few weeks ago, Groove in the Mood Canberra held Australia's first ever pill testing trial. There's been a debate on this issue for over a decade in Australia, with sniffer dogs being the preferred approach by police and the government. The results from the trial were pretty staggering.
The pill testing at GTM was a tremendous success. It was able to identify 2 capsules that could have contained potentially lethal contents that, if consumed, may have led to a death. The results also indicated high levels of high quality MDMA. So 50% of samples that were tested that did contain MDMA were very high purity.
The problem with extremely pure MDMA is that if the user doesn't know the strength of the drug, then there's potential for overdose. With pill testing, we see how advice can be given by a health professional on the basis of what's in your drugs, how pure it is, and how dangerous it is.
There's international evidence from 20 years of pill testing that demonstrates that this is an effective intervention. In Portugal, a study found that 24% of LSD capsules didn't contain LSD but contained another substance, and 74% of those attendees who received that information said they wouldn't be consuming those substances. In Canada, they found that 76% of people who had their drugs tested and were provided with results indicating that their drugs did not contain MDMA stated they wouldn't consume the drug and would warn their friends. So there is increasing evidence internationally to demonstrate that this reduces harm. Dr. Stephen Bright, Senior Lecturer of Addiction at Edith Cowan University.
Stephen is one of WA's top researchers in the field and says that in Australia, 95% of those who die from ecstasy die due to the adulterants in it, not the MDMA.
So what this trial has also done has provided a snapshot, some monitoring of actually what's going on in terms of the ACT drug market. And that information is important because if we know we're seeing high purity MDMA, then we can do harm reduction and get information out to people so that they reduce their dose, which may prevent an MDMA related death. Young Australians want to get their drugs tested. There was a survey conducted of 851 young Australians who attended festivals or nightclubs and took drugs, and they reported that 53% were consulting pill testing websites and 23% were using reagent test kits. So young people want to know what's in their drugs.
Those who oppose the idea of testing pills as a solution claim that it encourages drug use. But Stephen had a different thought.
So young people are not stupid. They know there's a risk with taking ecstasy, but that risk is somewhat intellectual. When you turn up at a festival and there is a pill testing site where there are posters stating that a particular pill contains a deadly drug, don't take that pill, or that this particular pill contains 250 milligrams of MDMA, don't double drop, take half a dose, it makes that risk a whole lot more real. So it's not encouraging drug use. In fact, what it's doing is it's making the perception of the risks associated with taking drugs real. So what I've heard from a lot of talkback radio that I've been involved in is parents saying they are really in support of this because they would feel more comfortable dropping their children off at a festival knowing that there's pill testing services available. They hope their kids don't take drugs and they've told their kids about the potential risks associated with it. But as I've said, young people know there are risks associated with it. And so parents would like to see this in place because it's going to mitigate that risk. It means that if their son or daughter goes to a festival, does make a decision to take a pill or another drug, that they are able to access a service to determine what's in that drug and potentially mitigate the risk and potentially save their life. What parent wouldn't want a service like that available?
Stephen's been a vocal advocate for pill testing in WA for a while now, and he's encouraged some of his students to do the same.
My name's Joe, and I'm looking at establishing a chapter of Students for Sensible Drug Policy at ECU and WA.
Hi, my name is Becky, and I'm also looking at establishing a chapter of Students for Sensible Drug Policy in ECU.
Students for Sensible Drug Policy is basically an international grassroots network of students who are concerned about the impacts current drug policy has on communities, our generation, and society at large.
Students for Sensible Drug Policy were part of the group of organisations who campaigned, planned, and ran the pill testing trial at GTM. Joe and Becky are trying to start the conversation here in WA among both university students and the general public.
I just think that the people that have already made the decision they're going to go out and take ecstasy or whatever drug it is that they want to consume, really, like I said, those people have already made that choice, and it's about making that choice safer for them to do so. If they still want to go ahead and do it, it's about giving them all the information that's necessary to make a healthier choice or the safest option for them. I think the climate around this sort of topic is changing. In young people and also old people, like I've brought up not only pill testing but just drug policy in general in Australia with a lot of I guess baby boomers that I know, and they've kind of had a very open approach to it. Like they're happy that they can see that the way we've been doing things over the last however many years, 10, 20 years or so, hasn't really been working for us, and they're ready for a change. They're more open to it. So I think the whole climate around drug culture is changing at the moment.
With all this evidence in support for pill testing, we still have a way to go until we finally see it at a festival here in WA.
The barrier at the moment to pill testing being initiated and implemented in Western Australia is due to a lack of political willpower, because many of the politicians don't actually fully understand how this works and the evidence base for it. In addition to this, there's a focus on zero tolerance policing, which is not consistent with Australia's national drug policy, and it's not effective. Each sniffer dog costs about $2,000 per hour and provides about 60 to 80% false positives. That means it's detecting people that are not actually carrying drugs. It can also lead to people consuming drugs they have on them, which could be for their friends, as was seen in the tragic death of Gemma Toms at the 2009 Big Day Out. In WA, we also need to see legislative changes allowing for healthcare professionals to be able to legally handle drugs. At the moment, we can't engage in a pill testing trial because as soon as the drugs are handed over to the healthcare professional, they are in breach of the law. So we need to change the legislation to allow for certain healthcare professionals to be able to handle drugs in the context of analysis and pill testing processes. And this is going to require a lot of cooperation between healthcare services and police.
After decades of the same policies, with the same outcomes of preventable deaths and overdoses, many like Stephen, Joe and Becky think it's time for a change on drug policy in Australia. If you want to find out more or join the conversation around pill testing, you can head to the Students for Sensible Drug Policy Facebook page or website.